We on that?
Right, yep, okay. We can call the Health and Human Services Committee meeting to order. We're just waiting for Elaine McNabb Coleman and Brian Muldrow's excused, and the rest of us are here. The Health and Human Services agenda has 13 resolutions tonight, 3 for the Health Department, 4 for DSS, 2 mental health, 1 Office for the Aging, and 1 HH12 is under the county attorney. There's also 1 appointment. Before I get that, could I get a motion to approve the minutes of February 9th?
All of them. 1 second.
Okay, any, all in favor?
Aye.
All right, great. As I said, there's 1 appointment to the Office for the Aging Advisory Board, and that's Karen Stewart from South Street in Auburn. Karen was a long-term county employee, worked in adult protective. She'll have a lot of background and be a good fit for the Office for the Aging. So can I get a motion for Karen's appointment to the OFA Advisory?
I'll second it.
All right, any, all in favor?
Aye.
All right, great. I spoke with Shireen earlier today, and there had been some conversations going around adopting and revising and restating our corporate compliance plan. We did end up on the Health and Human Services agenda with the plan that was also incorporated. And I guess the decision to put it on the Health and Human Services agenda had more to do with the 2 departments that are under this corporate compliance plan reporting to this committee. So at this point, it's a required plan that applies to the health department and to the county mental health, as they provide Medicare, health services, medical services. They bill Medicare, Medicaid, and third-party insurance. And this is a requirement if you are doing that to actually have a plan. Rich can talk a little bit more to it, but Shireen does have some PowerPoints available. But she explained to me that she's going to be reviewing in detail these PowerPoints at the legislative meeting, because she has a requirement to train the full legislature on this corporate compliance plan. So if we wanted to all wait until our ledge meeting to have her go over the plan, we can just move this particular compliance plan forward and to get it on the ledge agenda. It's up to the committee if they want to see the PowerPoints now, or they want to just go ahead and wait till the full ledge meeting to do the training. So do we?
I don't see any reason to sit through it twice, so.
Okay.
It
$5 bill. All right, great. Rich, did you have?
100%.
Yeah, just kind of a real brief overview on why we're doing it. The compliance program was initiated, I think, back in 2010, when Medicaid and Medicare came through these regulations requiring all organizations who bill Medicare, Medicaid, a certain amount of money, you have to have a compliance program. Basically, in the briefest terms, it's an audit program. So we have an internal audit process. We have an overview of that process and a reporting program, so that the ones who are doing the billing are subject to the internal audits within their departments. And if there's any problems, that will get reported up through the chain of command, so to speak, to the compliance officer, and through the compliance officer to the full ledge. We're obligated to have that kind of a reporting function up through the governing body. So that's why we have the plan in place. Many things have changed since 2010, obviously. We did a revamp in 2019, but things have changed even since then. Obviously, we now have an operations officer, whereas before we had actually it was a deputy treasurer who was appointed the compliance officer back then. So we needed to update the plan, address the changes that we've done internally. We've also somewhat consolidated it. I think the plan in 2019 included the sheriff's department, and back at that time,
County nursing.
mental health and DSS
And
were
nursing
combined,
home.
and the
Yep.
nursing home. And so we've made those kinds of organizational adjustments. And the PowerPoint itself will go over, in egregious detail.
Right.
The elements of the.
And there's probably an annual mandate to train.
There is an annual mandate to
Yeah.
train at all levels. So,
Right.
this is something we need to bring to the Board of Health as well as the legislators and also the Community Services Board. They all need to be included in the program.
Right. So can, at this point, we'll move the HH 12 forward, adopting the revised and restated corporate compliance plan and be part of the training at the ledge meeting. Can I get a motion for HH 12?
I'll move it.
Langdale, second.
Okay. Any questions? All right, all in favor?
Aye.
All right, great. Since we started at the bottom, maybe we can just move upward and have Brenda come and talk about her 3 resolutions. HH, we could group them really together. HH 9 is authorizing to fill a food service helper position at OFA. 10 is to increase the hourly wage for that part-time worker. I think to $15.30. She's having some difficulty finding someone to take the position. And it's an hourly rate position. And the 3rd is authorizing the Office for the Aging to sign contracts for services to produce and mail their quarterly newsletter, which is, you do it every quarter and you have a new vendor, is that?
Correct.
Yes, okay. So if you don't mind, let's group together HH 9, 10, 11. I'll get a motion and then we can open it up to questions.
I'll move it as a bundle.
Second?
Second, Lydia.
Great. Okay, all in favor. All right, are there any questions?
I do have a question.
Sure.
Thank you. On the budget. It's all budgeted. Thank you.
That was hard.
Right.
She was prepared.
I want to be here with the day you say, nah, not really. Yeah.
Thank you.
And it is that question's about both of the food worker.
Absolutely.
Yeah.
I can even happily report that we did receive a COLA increase from New York State for our nutrition program.
Thank you for that. Very nice.
So it's not only in the budget, we have more money coming.
Excellent.
Any other questions about the authorization to fill and the change in the hourly rate to $15.30? Okay. All right, and okay, all in favor of HH 9, 10, and 11?
Aye.
Any opposed? Okay. We voted before you came here to wait for our corporate compliance training until the full ledge, when we're all going to be trained on it. I know it. She said, oh darn.
Sounds like a wonderful idea.
Another good answer.
Okay, Brenda, do you want to talk about things on your report or?
Well, I do want to invite everybody here, anybody and everybody in the room who might be interested in coming out and spending some time with our Meals on Wheels program. We are filling slots with individuals. We have 15 routes. We have 3 congregate sites right here in the city. So if you want to start small, we'll have you come to one of our sites and help serve the food to the individuals that come to that. If you want to go a little bigger, we'll send you out on the road with one of our staff or volunteers to deliver home delivered meals out in the community. Elaine has already volunteered, but we have some slots left that we'd love to have the others of you here participate, and the more the merrier. And it's really everybody who does it always has a good time. So we encourage you to do that. And it's just kind of a way to for everybody to kind of see what that program does, what the volunteers do. The volunteers love it because, that it kind of shows that we appreciate what they do when leaders in the community come out and support the program. So please let us know if you're interested. I did put our volunteer coordinator's phone number on my update, and that's really the easiest way. But if you just call or email our main line, we'll also make sure we connect you with her.
I'll tell you the real story. I volunteered at the site and they said, yeah, thanks a lot, Elaine, but next year you're going in the car. Okay.
Brenda, I have a
And then
quick
after
question
that,
on
we'll
that.
send you out on the 80-mile road
Yeah, right, right.
Yeah.
What are those hours?
for the meals delivery. It's pretty early because it takes a while to, an hour or two, depending on the route. Or so the
Well, just
congregate
'cause-
sites.
Because I
are-
teach, it's hard for me to
Yeah.
take time off, so I just
Yeah.
didn't know what time of the day.
So the answer is depends, but the local ones right here are about 11:15 to noon. And you can pop in and out if, we'll call us with your schedule and then we'll see if we can find something that fits.
Okay,
All right.
okay.
Yeah, thank you. The other thing
Regarding that as
sorry.
well, are you well staffed with volunteers? In the past, you had struggled?
Oh my gosh, Kim Dungy, our volunteer coordinator, is absolutely doing an amazing job. She has like a command central at her desk to schedule the about 80 volunteers that we have. But we were talking today, we do have a waiting list of more people than we've ever had before. I can't give you the exact number. So we just see this need continuing to grow. It is not a lack of funding right now. It's a lack of enough volunteers. We just did 5 weeks of advertising in the shopper down in Moravia. We've got tear off flyers. We've got posters in the bank. We just don't have enough. So it's a real dilemma. It's a great question. So the ones we have are doing a great job. We've noticed a change in our volunteers. We used to have a smaller volunteer pool that volunteered more days a week. And we're pretty much here year round. The volunteers we're seeing now have busier lives and they're willing to contribute, but they might contribute 1 day a week and they might go to Florida for 3 months out of the year. And we're happy to have them, but it does then mean we need even more people to cover all the routes. The waiting list that we've got, it would typically take 5 new volunteers to cover that new waiting list. If all those 5 people, as I've explained before, or if all those people on the waiting list happen to live in the same area, that's always the other challenge, that sometimes they're at different ends of the county where we have people on waiting lists. And we're limited, the volunteers are limited in the capacity of the hot meal containers and the coolers that go in vehicles. The hot meal containers, we deliver the meal hot to the house, and so we have to plug it in. So that's a challenge. And then depending on the size of a car, sometimes they can only do 14 to 16 meals per delivery person. It's a lot of logistics. But the short answer, I'm sorry, that was a really long answer. The short answer is we always need more.
Right.
Always need more.
And eligibility, do our elders by nature of being older automatically qualify, or is there income eligibility or health eligibility requirements for them?
So our congregate meals that are here in the city that anybody can attend who's 60 and over, and it's a suggested donation. There's a small form they fill out to register for the program for our funding, but anybody 60 and over can participate. Our home delivered meal program is an eligibility based program, and it is based on a number of factors. We have a prioritized waiting list based on it is health, it's socioeconomic, it's a whole number of different factors. Our screening process works through the options with folks if they're not eligible for home delivered meals, what else is out there that might meet their needs.
Any other questions for Brenda?
Sorry, just one more. You talked about there being 3 locations. Do you mind telling us where those locations
Absolutely.
are?
They're at the Schwartz Towers, the Stryker Homes, and Boyle Senior Center.
Thank you.
I did also just want to give you a really quick update. Our subcontracted aides that are working in-house with us, they come to our office every day. They are driving our county OFA car. They're working out beautifully. We were given 2 absolutely wonderful people who are going out into some challenging situations. They're driving all the way to Fairhaven and Moravia throughout the week. These were the people that we could not serve because we couldn't get aid agencies to send aides out there. So bringing aides on board, we were immediately able to provide service to people that we haven't been able to serve for months and months. So it's very exciting to have those aides working with us. That continues to go really well. Thank you.
Yeah, that was great.
Thanks a lot, Brenda.
All right, thank you.
Thank you.
Sorry. I have 2 resolutions tonight. Maybe we could group together HH 8 and HH 13 that was added. HH8 is to allow her to enter into a contract for mental health counseling. It's my understanding one of the contract mental health counselors has resigned.
One of our part-time.
Yep, so this would be a part-time replacement for that individual.
This will be, so the part-time person is now going to be contracting with us instead of a part-time employee. So that's,
Oh,
so we had budget, we have it in our budget to be able to contract with social workers as well. So she's opting to kind of change from part-time to a contract worker.
okay, okay, I'll ask you after.
Yeah.
HH13 is to fill a senior typist that recently resigned.
Yeah, so senior typist resigned and will be, her last day will be the 20th or 21st, I believe. And so this would be reclassifying her position to a senior clerk, making all the front office staff all the same title, doing the same work, so.
And I didn't really look at that because it came late. Is that the same? Well, can we
Yeah.
get a motion for HH8 and HH13?
I'll move it. A second.
Okay. I assume you don't have to move money from your .1 to your .4 to cover this change in this point. You don't. If you ran out, you would have to, but okay.
Yep.
You'll just take it out of your professional services line instead of your part-time salary
Yep, which
line.
we have a contract worker and that we have in our budget anyways in the professional services.
That's already filled.
Yeah, well, that would be filled by her. Yeah.
Oh, okay, that, an opening.
Yes,
for
an
contract
opening of a
worker.
contract
Okay,
worker.
I understand. And the senior typist conversion is same grade?
I do believe it is the same grade, yes. I think
Okay.
it is, it's on the resolution, but I'm almost
Okay,
100%
A little
positive.
lower.
it's the newer one that just came out.
Right,
So yeah, the starting
the starting.
would be lower than, yeah.
Okay, but it was,
And it's
it's the
budgeted.
same grade, it's just started at step one. Any other questions about HH8 or HH13? All in favor?
Aye.
Aye. Okay, all right, great.
Just a couple updates. I put a clinic update just because we have, we've been extremely busy. I think a couple just other interesting stats that I have besides what I put on my report was, our census is up to 2,215 clients. That's up from like last year at this time, about 215 clients or so, 220. Our average therapist caseload is now 94 people on their caseloads. And I think this one is very interesting. So the average new intakes per month last year was 133 new clients each month. This year, we're averaging about 146. And in the last 30 days, we've had 160 new intakes, which is that is the busiest that we have been. So I just want to point that out, that we're extremely busy and we continue to offer open access services. So there's no waiting list at all to see a therapist at all at our clinic, which I think is pretty amazing considering how many clients we're seeing at this time.
Are you able to actually serve people in a timely manner?
We are, I mean, I think, I think it gets tricky and I
Yeah, I
think it's
mean,
hard
at
for
some point,
therapists to,
right.
they really have to see how often they're seeing some clients. Maybe there are some times they'd like to see them a little bit sooner, but their schedules don't allow that because they're so busy. Yeah, I mean, and I think a lot of clinics across the state have wait lists of 3 to 6 months to even see a therapist. And then even our prescribing staff, I mean, you could come in for an intake and I think within the month you could see a psychiatrist or a nurse practitioner, which is also
That's remarkable.
really unheard of. So I just want to point that out, that we have a really good mental health clinic here with a lot of therapists that are extremely busy, but that are continuing to serve the need. Obviously, it's a greater need than it ever was before. I think this is the most clients we've ever had in our census.
Will there come a point where you say, hey,
I don't ever want to get to that point because I think that's what makes, to walk in and be able to see somebody is really important, especially a lot of the high risk people. Then you gotta triage people and only see the ones that are more high risk, but the other people still need it. So I really wouldn't.
Is there anything that kind of lets, why the numbers might be going up? Is it more awareness of seeking out help now? Or is there things happening in the community we should be aware of that is causing these numbers to go up?
It could be a combination, I think. I think more people could be seeking help. I think there's been a huge investment and people have been talking about mental health services a lot more since the pandemic than probably ever before. I don't know. It's really hard to pinpoint, but I think we have seen an increase. Like I think I put on the report as far as like, the adolescents and kids that we're seeing, there's such an increase there. So I think that has to do with the impact of the pandemic and being isolated from school and, all of those things.
Years ago, you didn't serve as many young children as you do now. Is that
No, I mean,
the
yeah.
case?
Mhm.
So recently you've opened up to the younger population.
Yeah, I mean, I don't know if we've always served them, so I don't know if it just wasn't, the numbers just weren't there, so
Yeah.
maybe, at this time, more kids and adolescents are coming to the county mental health center, so.
Do you have that data available?
I can get it, yeah.
Thank you.
Yeah, we can't be unique. It's happening all over the country,
Oh,
isn't it? Okay, we're not anything special.
Yeah.
All right.
Yeah,
Second question is the parking better out there,
it is a little bit better, yes,
gonna get better.
yes, and hopefully it gets even better than that, so,
especially with all these new clients. I mean, it's
yeah,
tough to
yeah.
find a parking place.
Yep,
All right, whatever we can.
thank you. And then, so mobile crisis, I've been talking about this for so long.
Here.
We did hire a health home care manager that will be starting on the 20th. That will allow the person that's in that position to now be the crisis care manager for daytime mobile crisis. And we have hired a social worker. She did come to work on Monday, so she has officially started. And we also, we had the person that's retiring, so we do have somebody to fill that position as well. So other than our senior clerk, as in the middle of April, we'll be fully staffed, hopefully, so. We'll be able to, once the onboarding happens with the new therapist and we start being able to transfer cases to them, then we will start the mobile crisis program, so.
Do you have any idea what the volume of calls have been to the police and sheriff's department without this? I mean, that would be interesting to look at.
It would be interesting. I know the police bring a lot of people into my
Yeah.
house. We do have those numbers and I think, there were, you can see that we've had 143 crisis walk-ins since the beginning of January.
Okay.
So I think we'll continue to get those walk-ins, but some of those may be
Law
mobile crisis
enforcement.
calls,
Okay.
Yep. So we do have the numbers as far as them bringing however many crisis walk-ins to the clinic overall.
And you'll be able to do some work remotely too? Did I make that up? There's computers.
Well, they'll be able to, when they're not out in the field, they can still take crisis calls that come into the clinic or see people that come into the clinic. So that will help with the whole, serving the crisis need as well for people.
So the mobile piece, when they're out in the field, is that initiated through 911? And then there's a decision about this doesn't really need criminal justice intervention, it needs mental health intervention. Is that
So there's going to be,
how it becomes mobile?
there'll be a lot of referral sources for mobile crisis.
Okay.
Law enforcement is one of them, so calls into 911. We're working actually on the new grant that we got about to do 911 diversion of those calls that law enforcement doesn't need to respond, but mental health professional would need to respond. We're working with 988, so that's the statewide initiative. And they're able to refer to mobile crisis. We'll have school districts able to. I mean, there'll be a variety. So we really want to we have to figure out how we're going to roll it out. I don't know that we can just open it up right from the beginning and kind of see where it goes. I think we'll roll it out to probably law enforcement first and then go from there. So it'll be interesting to see the need too, how many calls we're getting. I know it probably will be beneficial to a lot of the school districts as well.
I know this is a lot of minutia, but do we have a dedicated vehicle?
We do have a vehicle.
Mhm.
Thanks to DSS, we do have a vehicle.
Yeah.
Yeah, we've been prepared. We're
Right.
just waiting.
Yeah.
For the
For
hire.
the social worker
Yeah.
or the case manager?
Yeah, but we'll both, because one started and
Oh.
didn't really start and then,
Right.
so I'm hopeful that we're in a good place now and we'll be able to start that as soon as we can. So,
Significant work. Thank you.
and then you'll see the Healing Cayuga updates. There's a lot of, really good data there as well. There underneath the BJA grant, you'll see those are all the new initiatives that we're working on, the new grant that Monica wrote for the county. We're partnering with all different partners on a lot of the work. I know I've been talking about that a lot, but I just wanted to include some of the work from Healing Cayuga. That Healing Community Study has officially come to a complete end. At the end of this month, that study will be, the implementation period had already ended, but it was extended a little bit, but that'll be over with at the end of this month. And I just have to say how just great the work is that they've done. I mean, we've come a long way to have more bystanders administering Narcan than first responders. I think that's huge. Overdoses have gone down. I think it says, like 43%. And that's against what's happening elsewhere. So I think it's really something cool that they were able to do. So.
And the coordination that comes out of mental health through Monica and the epidemiologist creatively is funded through this grant, and the opioid money are coming together to be able to keep that coordination going and get the real-time data that we're getting, right?
And still continuing to look for other grants as well for other funding. So.
Great.
So with the actual finishing out of the expenditures of the Healing Communities Grant, are we gonna hear a new word for this coordinating committee or a new phrase?
I think they're just using Healing Cayuga instead of Healing Community Study. They've sort of-
And I know that the results of all the work came to basically national attention and brought in a PBS crew. Do we know yet the air date?
We do not know the air date, but when I find out, I'll make sure I let you all know. I'll make sure Monica lets me know,
Okay.
and then I'll let all of you know.
Yeah.
April, you're thinking?
Yeah, and there'll be like a link, so it'll be, if you don't see it live, when it's aired, you'll be able to watch the recording of it. So, which is also.
It's phenomenal.
Yeah, Brian was interviewed, a bunch of people in the
Yeah,
community were interviewed,
They went to
right?
Nick's Ride. Jail. Spoke to Dr. Duckett, came to our office, so there's a lot of people that were
Familiar
interviewed.
faces.
Yes.
All right,
Thank you.
thank you.
Thanks, Laura.
Sorry, one other thing. Your voice was inside my head. I went to, yes, and I appreciate it. I was at a Erie Canal Way Trail Improvements public meeting last night. And anybody can make recommendations by using your phone to use this UPC or whatever they call it to make recommendations. And one of the things that they're looking for is feedback on how to refine the design of trail improvements and new amenities. And one of the new amenities that I recommended is Narcan along the trail. So anybody can do that, I would ask, because that's in the outlying areas that you're targeting. So I would recommend that people do that, please. Thank
That's a
you.
really good idea.
Thanks, Laura.
Thank you. Hey. We're going up the agenda. We'll go to social services. And let's start with HH4. if we want to.
HH4 is for us to enter into a contract with Booker T. Washington for their summer recreational summer camp program that they have. It's 100% funded through our FFS, which is Flexible Family Services Funds. And they do, everybody that qualifies is TANF eligible.
In summer camp.
Summer camp is $15,000. They have two sessions of summer camp. They serve a large number of children in the community.
Can I get a motion for that?
I'll move it.
Second.
Second.
Any other questions on that? You've done this before? Yes. Yeah. All right. All in favor?
Aye.
Any opposed? All right, great. Okay, HH5 is authorizing the chair to extend a contract with Housing Vision Consultants. And I actually did follow up with Chris Trevisini on this. As you all remember, we dedicated $250,000 to Housing Visions to help us with the redesign of Grant Ave for a homeless shelter, to move it to, I think, 50 beds and some transitional housing. And all this resolution is doing is asking to extend the period of this contract. And I asked Chris if the question came up, why the extension, I'd be able to address it. And I don't know if everyone is aware, but this project on Grant Ave is part of a larger proposal that they're doing in this community. And all of the pieces had to fall into place for this to go forward. He did say the original timeline was fairly aggressive. There were delays in getting Chapel House purchase contracts signed because in order for this to move forward, Housing Visions is going to be purchasing from Chapel House this location. So there was some issues with the assessed value, and so that took a little longer. Also, part of the overall project is the design, is the State Street project that's going to be taking that 197 State Street and making it affordable housing. So there was a little bit of a delay with that. He did say that he didn't want to spend a lot of the county money of the 250 that we appropriated to him until he was aware that all the projects would move forward. So he's asking for the extension. He's spent right now very little of that 250. And, he assured all of us that he is extremely committed to making this project work. So that's the reason for the request for the extension. It is moving forward, but, things are complicated and take a little bit more time. Do you have anything to add to that?
No, that was good.
Okay. All right, so can I get a motion to extend the contract with Housing Visions? Same amount of money, HH5. Can I get a motion?
Yeah, move it.
Second.
Okay, all in favor?
Aye.
All right, great. Okay, HH6.
HH6 is for us to fill two budgeted human service examiner positions, and one in child support, one in HEAF, two folks that have submitted their resignations as well.
Can I get a motion for that? HH6? Second?
Second.
Okay, any questions? Filling the budget of vacancies?
Budgeted rates.
Yep, let's hope we can fill them, right? All in favor?
Aye. Just follow up on,
Yep.
you do, or are you able to, with HR, do, exit interviews to find out what we could have done to retain the person? Do we have data like that as a county in these positions to help you retain?
We
Is
usually
it
do
just
our
the
own,
Finding better position,
we usually do our own exit interviews since we know why people are moving on.
right?
Have conversations with them. Some of it is simply they're moving on to different positions in the county where they're making more money.
Oh.
That's what we've been seeing a lot of lately, like moving to different departments. Some people are retiring, they're done, working. So, we do have data on why our folks are leaving. We're definitely, like, this human services examiner position is one that has been just constant turnover of staff, and that, lately.
This is where you got the exemption from civil service for this title?
This is the one that we're working on getting
Oh,
that
you haven't gotten it
exemption.
approved.
It's right. We have to, but there's still some more steps that we have to work through with civil service to exempt.
Exempt them from a test and be able to bring them on.
Mhm.
But you think you're confident?
I think we'll get there. Yep.
Good. Okay, thank you. Any other questions? Or we did vote on that, did we, Sarah?
No,
No?
not yet.
All right.
Oh,
Thought we
I
did.
think we did, I just had
That's
the follow
Yeah, she
up
was-
after.
Okay.
Oh,
All right, and HH7 is the request to purchase the 3 vehicles that were part of your 2023 budget.
Yep. Part of our budget, $75,000 plus the ability to go up by 5,000 if we need to, depending on what the bid comes in at for the vehicles.
I'll move it.
Second, okay. Questions on that? All in favor?
Aye.
Great, great.
I missed, I'm sorry, I missed the deadline to put some information in the report, but I did want to tell you that, we talked about the number that we have in, the Reading Emergency Bonus, on a certain, date. And today it looks like, probably the biggest number that I've ever had to report to you guys. We have 83 single males, 51 single females, and 26 families being provided emergency housing right now. So that is something that we haven't seen, so we're talking about 160.
yeah, well,
Yes,
that's great.
the hotels are very, very full. And I think that some of it has been the colder weather. We're, seeing colder weather than we have earlier in the winter, and we're hoping that things are going to trend down as things warm up. But I think this is, you know, part of the ongoing problem that we have with affordable housing and moving people out into permanent housing, and there's not an easy fix. Concerning, you know, that because of, you know, our volume of people in the hotels is getting higher and higher.
And can you speak a little to the, there was some conversation that a significant number of these people, when you look at them, their last known address was outside of Cayuga County.
Mhm.
And you're not finding that to be true?
No, I think we looked at that last week, I think it was,
Yeah.
and on the day that I asked, there was only 8 individuals or actually had never had roots in Cayuga County.
8 of
Eight of
132 or
those,
something.
whatever that number was that day, 150, 160. There was only 8 of those people that we were providing housing to that came in from somewhere else that didn't have roots here, hadn't had history here, hadn't lived here. And so it's not a large number. I mean, you see sometimes people will, you know, go stay with someone else for a little while and come back, but we can tell that they've been here. This is their home. This is where they grew up here. So there is kind of this notion that people come from outside of the area and they're kind of flooding in. That's really not the case. So that's kind of, you know, something that we take a look at, and the people in our intake know, they know the numbers, and they're the ones that told us that it's not a ton of people.
I have another question on that. Are you finding that the numbers are increasing as the city is starting to crack down on the nuisance properties and foreclosing those? Are you seeing your numbers going up as a result of that?
I don't think that that's had a significant impact. I think that there are a few, and we found out about a few of those houses, and you know, some of the folks have come our way for housing, but I don't think that it's a large number of this, or that the spike is because of that.
Yeah, and it's great that we can help these people. I mean, it's a lot of people. It's great. Where are we finding the housing? Is there enough hotels and is there enough rooms? That's a
So
lot.
we've been able to, I mean, right now, we have people at, you know, there's a number of hotels that we use in the city,
Right.
you know, DLI's outside the city, Weedsport. I mean, so we are, anybody that wants to sign on,
Mhm.
you know, we're filling them up with the
We're
beds that
talking
they'll
like
give us.
90 to 100 a day.
No, we have, it was 160.
No, I mean, money.
Oh, how,
Money.
about an average of about $100
Yeah.
a day per bed.
Well,
And I think everybody in this room is agreeing. Housing homeless, meeting this need by hoteling people is not the way to go.
for
So I
sure.
mean, this whole issue around the development of these additional shelter beds, you can't come soon enough.
Right, I
And
mean,
there's also the State Street project, the old Polish home
Mhm.
that's being revitalized into a 14 to 16 single person apartments, one bed apartments.
I think that will help. I think any permanent supportive apartments, you know, will help. I think, you know, as maybe landlords will start to become a little bit more willing to rent again. I think, you know, I was talking with someone about this just yesterday, that landlords that had apartments and rented them and then didn't get paid rent for years have just sort of stepped away from wanting to rent. And
With the
so-
moratorium on
With
the.
them, yeah. And so they are gun shy now to rent to folks. And so their apartments, I'm not sure if they're even filling them, but people that we were able to work with to, you know, put folks into those places are not willing to rent those places anymore. So I think that it's just the challenge of finding
That's probably.
apartments. But to speak to the situation with the concern with the hotels, and there isn't security. You know, there isn't the kind of supervision that happens in a shelter. There's a lot of, you know, crime. You know, people can be exploited. There's people that are very vulnerable. We've had, you know, issues with that. I mean, I know that I've talked to the city about, you know, the police calls, the sheriff about police calls and things that happen. So it is definitely not the ideal way to provide emergency housing to individuals or families. Yeah.
Guess I got one more question. I know you said there's only 8 people out of 160 or whatever, but those 8 people cost us $800 a day. Is there anything we can do to prevent? I mean, we don't want to be mean, but you know what I'm saying? They're not our county residents.
So we don't have the ability to just turn them away and say you have to go somewhere else, because our regulations require us to provide emergency housing to people that are eligible where they are found. So if their need, and they're found in Cayuga County, that's their need, they're here, then we have to provide that to them, just like
Which is
every other
good. I
county.
mean, it's good that they have a place to go. But again, they're from other counties. And I'm wondering, what do they just come? I mean, how do we
It's a
get?
variety. Some people are traveling through,
Okay.
you know, some people maybe knew someone here, met someone here, sometimes online stuff. You know, they
Right.
come here to spend time with someone and then, you know, didn't work out. And so then they don't have any money. They didn't really think ahead, didn't have the resources, and they're stuck and don't have any place to go. You know,
Well,
some of those people will move on,
yeah,
you know,
I'm sure.
and not stay here forever. But if they're here,
No,
they're
that's-
eligible,
We gotta
and
take
they
care of them.
come here.
It's what good people do. That's what we're supposed to do. Well, they're not our residents, but that's okay. We'll live through it.
The 26 families, how would you describe them? Would you describe them as single moms and children?
Okay,
Is there a kind of, oh, it's okay.
okay. Okay. I wouldn't say there's a certain, you know,
It's a real mix.
that's a mix. Some have one or two kids, some have a group of kids, you know, 3, 4, 5. Some of them are placed at the transitional housing through Merriman.
Right.
And then others are at hotels.
And as I understand, is Merriman specifically for women and children?
Yep.
Okay. So there isn't a father in the picture or a male?
At
in the picture
at
or a
rescue
partner in
missions,
the
no,
picture?
that's women and children.
And how many of those apartments exist?
8 of the 26. And those are always full.
And they have a full year of transitional time there, correct? Isn't it 1 year?
I will have to get back to you on that. I thought it was a shorter time frame, but I don't want to say 100%.
Okay.
I can let you know.
Yeah, if you could, thank you.
Other news?
Good job.
That's my news.
Okay,
Thank you.
okay, all
Good
right,
job.
thanks a lot.
Good job.
Vic, do you want to say anything to the committee before Kathleen goes?
Well, if anyone had any questions on my
Uh-huh.
update, I just have a couple things I can update on it from a week ago.
Okay.
The applications are slowly trickling in for the OCFS funding. I'm finding that we are getting some new applicants, people that haven't applied for money before, so that's been great to see. I know that I've also networked and reached out to, I know DSS has been helpful, United Way. I had a great meeting at the Cato Rec Center, so I met with the MIC program today and the school district about doing something for the summer. So it's been nice to get out in the community and talk to some other people who didn't know that the Youth Bureau existed. They didn't know what we did. So it's been nice to educate a lot of people on what we are able to do for them possibly. I have a new board member that has reached out this week and I'll be sending his appointment letter. His name is Robert Ryan. So I'll be looking for 2 more members at that point. So we're almost full. So that's great timing because I'm hoping to have my first full board meeting at the first part of April after we get all the applications in. So we're able to do the allocations for the OCFS money specifically by hopefully mid to end of April. Because a lot of people are looking for funding specifically for summer programs for the summer.
Is there any type of member you're looking for? I know you've got the youth filled.
Yep, I have one more youth that I would need, just a community member, just anyone in the community that's interested in working with youth, maybe even somebody outside of the city, somebody in more of a rural area that might be able to talk more about the needs, be able to represent their area better.
Okay. And you and Lydia are on, right?
Mhm.
Yes, and the number you're looking for, the 3 community members, and you just mentioned one other, so you're down to 2. Does that include?
And it does include Ashley. I'm not sure if you were able to.
Yeah, I'll have, for
Okay.
you tomorrow, I'll have the information you need to fill
All
out
right, perfect.
the form, so it does include her.
Yes, ma'am.
So basically that leaves you with 1, right?
Yeah, because I wasn't sure 100% if she was
Yeah.
able to it or not.
Is Ashley the youth?
What's that?
Is Ashley the youth?
No, Ashley's is an adult. I've also referred to a youth person, but, so I just wanted to know, how that 3 played out, so I could help with anything else.
Okay. Yeah, if you could reach
So
out to Ashley.
looking for a rural, we don't have much rural representation yet?
No, just for youth, we have one youth, 2 youth rural and then Lydia.
Okay,
That she would be considered a rural area.
right.
I haven't heard back from her yet.
Okay. I'll reach out to her.
Okay. If she could be.
Deb, when was your first board meeting? You haven't had a board meeting.
I haven't
yet.
had a board meeting yet.
And
I'm
it's coming
waiting
up,
to
you
do
said?
the first one. So the applications are due back to me March 24th. So after that, I'd like to have the first one.
Great.
I'm hoping to do them here in one of the caucus rooms and have Zoom available for those that aren't able to attend, just so we can all get together and at least initially look over the first round of applications that we have.
Could you let all the legislators know in case they want to come?
Yep,
I
absolutely.
know Lydia and Heidi will, I'm sure, be there, but if you could let us know.
Yep, of
Thanks.
That's not bad for first quarter.
Yeah.
Mhm.
Great job.
Thank you.
Thank you.
Thanks, Deb.
That's her last bit, guys. I was just gonna say that. Maybe we can just start with the resolutions, Kathleen, and we'll group them together. Your first resolution is allowing you to accept New York State funding to participate in the federally funded program strengthening the public health infrastructure, workforce, and data systems. And that really is allowing, this resolution is recognizing the department is going to receive about $130,000 for this purpose each year for the next 5 years. Correct. Okay. HH2 is having the public health director contract with multiple agencies, school districts, and individuals for the provision of services for eligible children in the 3 to 5 program, the education, preschool, special education. In the resolution, these are the rates that we just approved last June
Yeah,
or August. And then these rates will continue on until amended or
it was July 1st.
Oh.
They think, so it's the school year that was set the rate.
Yep, but they'll be enforced unless you come forward with a change in these rates. But these rates had just been changed and they hadn't been changed prior to that in a while.
Correct.
And then the third is to authorize you to purchase the one vehicle for your department that you have in your 2023 budget, correct? Okay, can I get a motion for HH 1, 2, and 3, and then we'll open it up to questions if there is any.
I move to bundle HH1.
A second.
Okay. Any questions on those 3 resolutions? All in favor?
Hi.
All right, great. You want to talk about stuff? Yes.
I'll do a quick thank you to Diane Ferris. They came down last week to talk about ways that the county and they can help us support looking to fill a number of our vacancies. And it was certainly helpful to get ideas and to see what can be done. We saw some of the jobs up on the electronic bulletin board. So you never know who's walking through. We might do that. So that's a good thing. And then we're talking about the contracts for preschool, the RFP for preschool transportation. We will shortly have something. So your offices are in the midst of being contacted to set up some meetings for Friday. And looking at Shireen and Rich and Chris for that, because it's a very time sensitive process we're going through. So those are in addition to the lots and lots of information that we wrote and shared, but I've got some additional information here to share with the committee. So what I have here is some information I put together to speak to what some of the work the health department does. That's the first page. And what we wrote down here is the mandatory work that we need to accomplish, reflecting on the regulatory aspect of it and the state aid work, regulatory work, and then some of our grant funded work. That's page 1. My purpose in doing that is really to provide some background as to what the department does. Because revisiting what we spoke about, request to fill a deputy director position for the health department. So on page 2, we speak to a little bit more information. The deputy director position would be a non-bargaining grade 6. This grant will pay for the whole thing, for that whole position, for the duration of the grant period. So that goes till November 2027.
That's salary and fringe benefits. Assuming we're able to move forward with that position, after that time period, this position is state aid eligible for its work as well, for the salary and fringe benefits. Legitimately, you should ask, why do you need one? So I wrote down some of the reasons why it will be beneficial to the department. And certainly providing assistance and daily oversight, providing a second in command when I'm not available. A big issue that is not a secret, really, we have such a gap in our high-level management positions. There's a need to really maintain and help with its programs that don't have supervision right now. So that would be incredibly beneficial. In looking at our number of management staff right now, and I included myself, and I'm 53 years old, the average age is 61 of our management staff. So I pulled down the average. So that's telling you what the average is. A lot of after hours requirements that we have. We are a 24/7, 365 operation. And I added a few examples of some of our more recent after hours type work that we are called in to do. Right now, there's 2 of us that respond to those after hours calls. It's me and it's our environmental health director. And then certainly, again, one of the reasons we speak to the regulatory things, as all of you know, our licensed home care, diagnostic and treatment, early intervention, preschool special ed. Those programs in particular are overseen by state agencies, and we do get surveyed on all of them, along with just the quality of work that we need to perform because it's interacting with people, right? And it impacts people's health. We want to minimize the likelihood of having mistakes, and not having appropriate staffing certainly can lead to that. Ideas to benefit the county, the department and the county. There's some fun stuff that we'll build. Help minimize chances for non-compliance, which again, if we're not in compliance, yes, there's corrective action that needs to be taken, but there's also adverse outcomes as well as potential fines that are associated with that. Head up new county projects, and we need somebody. The health department is in the next big round of the DREAMS project, and we have an enormous amount of documentation that some is keep it forever, some is keep it for 21 years. There's all sorts of regulation around that. That's going to be a big lift. So we want to increase our use of technology to increase efficiencies, assist with professional development. That's an area that we've really been lacking in for quite a few years, and will really help many of our staff members. As well as then provide me an opportunity to engage more, less in some of the day-to-day detail and a little more in some projects that I simply haven't been able to be part of, like our Medicaid redesign project, the Medicaid Waiver 115, which with involvement could bring some revenue into our county. We have rural health communities on our state agency. We have other committees on emerging issues that then I could engage more with. And a lot of what is done that way, there's when you have new regulations that are proposed, there's also opportunity to advocate on behalf of our county, if that's the case, or at minimum, inform all of you better about the pros and cons of certain proposals so that you can make determinations whether you choose to advocate further with state or federal people, as the course may be. We've had opportunities where we want to engage more with our colleges and universities, which of course is a wonderful thing because some of our best employees have come from internships. We have a couple agreements. We haven't even been able to pursue them. Cornell University has a master's in public health program. They want to help us with projects. We can't even look at that yet, or we don't have someone to pick that up. SU, we do that, but we do have agreements with other entities, but it takes people to supervise people and it takes time to do that. Certainly funding opportunities through grants, and the one that comes most to mind is because it's coming forward again. It's every few years, it cycles through HUD, which would provide, if we have to apply for, and then if we were accepted, work around lead poisoning prevention, but specifically, and we talk about funding that's necessary to fix some of the repairs, because it can be a real challenge for homeowners and property owners. It's a cost to fix some of the issues. Well, if we are able to go after this funding and it has to be a municipality that takes the lead, well, there's an opportunity for actual funding to go to some of our residents to make some permanent repairs, and thereby improve public health as far as lead poisoning. And then, of course, there's the priorities that come forward with our partners in our community health improvement plan, some long-term strategic planning that we really haven't been able to perform. So, that's some of the thoughts that I generated over the last little while. In addition to looking to fill this position, we're looking to change the job title. We have a role of supervising public health administrator. I'd like to change that to a director of health education and public information. It will be a cost savings because currently this position does get paid comp time, overtime and comp time. Whereas if we're able to create this new position, it would be a non-bargaining grade 5. And again, be a little bit more available after hours. The health department does not have on call, and I think we should, but that doesn't exist right now. Like I said, we're 24/7, so the calls go to non-bargaining people. In addition, we're anticipating one of our current nursing staff, one of our current RNs, finishing their bachelor's degree in nursing, which is wonderful. That makes a person eligible for a public health nurse position, which is an upgrade with some responsibilities that go with that. And ideally skill sets that allow them to be more independent in their work.
That's currently in your budget.
That
That is
is
not filled.
Correct. That is currently budgeted. We've been looking for that position. We're really pleased that there may be someone internally who will be eligible shortly for that position. And so I know it's important to a lot of people, to a lot of our legislators in particular, to be very cognizant of not increasing the budget, not increasing budgeted positions. And so if that is a factor that plays in determining, I would certainly be willing to not ask for a fill for the registered nurse position when it's vacated, when we promote someone into the PHN position. So that's my hope. I wanted to have some discussion and hear some of your initial reactions to this proposal. I realize, you've heard me speak to some of it, but perhaps haven't seen this level of detail yet. And see what you think.
Let me just get it straight, Kim. If you're looking naturally for a deputy director, so you're not, you're hopefully moved up somebody within, I'm hoping, and you're not going to replace the nurse. So you're actually going to be saving the county $67,000 a year because the deputy, at least for 5 years.
You're right. Yes.
So you're
That would be
saving the
correct.
county and not adding the position.
Correct.
How the hell can you not beat that?
I would agree with you. Yes, thank you. Yes, I agree.
And it seems to me, when I read the resolution about the CDC, what do they call it, infrastructure grant, that it's an ideal use of the money.
Yes.
Because that resolution explained the kinds of things that could happen with the money. And this is exactly where my thinking went. It just completely aligned with, it seemed to me, with what the resolution was saying that we could do with the money. 5 years. Let's not waste them, and let's get ready for, I remember just a few years ago, I heard a lot of talk about, you're talking about the age of your staff, and we had some big changes happening with directors and deputy directors, and almost every meeting there was some kind of use of the phrase not sustainability plan, but you know,
Succession plan.
succession planning. And it, you know, this is a 5-year, we have a 5-year opportunity of money to not only support the department and strengthen it, but perhaps work towards succession planning as well with anchoring people in the right places at the right time. I can't really think of a better use of the CDC money.
I agree. You know, I'm glad you brought that up because, you know, I had the benefit of being a deputy director for 14 years, 15 years, just about. And I tell you, the first few years, my head was just spinning with acronyms and that's no joke, right? And then you learn, then you go through surveys, then you go through regulations, and then you meet some of the partners and you can have a better comprehension of the breadth of responsibility of the department. And it takes a while. It's not something you can step into and perform adequately without having some exposure to it.
Yeah, sure.
Thank you for the presentation. I appreciate it. So what happened to the deputy director position before?
It was me. And when the Health and Human Service Division separated, that wasn't filled in the health department.
There was no public health director. There was a director of health and human services. And then the county decided to unmerge those two departments and merge DSS and mental health. That's where Ray Sari had come in. So the health department went out on its own, and Kathleen stopped being the deputy director for health and became the public health director. And
I would
there was
say,
no-
Lydia, I've asked for the fill for a few years. This is the first time I have 100% funding to be able to take care of that.
Yeah,
another
sure.
question, please.
So what other considerations did you give for this grant?
Some strategic planning, some training for our staff, some team building. That's pretty much it at the moment.
Because there will be excess after
There will
you.
be excess
After the
after this.
salary and fringe is.
And we don't know yet whether we'll be able to carry forward. I'm hopeful that they'll let us carry forward unspent funds into the following year so that we can really give some thought. We can do IT work, we can do software. One of the things I was thinking, honestly, with the Dreams Project and the work we have to do, I'd love to contract with someone to help scan the pages of paper that need to be done for that project when it becomes our turn.
I think the most difficult, and you know, it's no secret you have wanted to get this deputy for your own succession planning and to free you up for some of the additional things. I think the most difficult part right now is that you got the Director of Community Health Services vacancy. Even if the county gives you permission to fill, I'm not sure when I don't know how long it will take you to get that position filled.
Correct.
The public health, you might promote from within, but you might not have the backfill. I mean,
Right.
it's so difficult to get people, and you're losing so many key people
Yes.
at one point, you know, that this would be another individual helping to oversee, supervise, and learn the programs.
And that's just huge. Now, I got word earlier this week. Our remaining division director has identified in 2024 her retirement plans. We have someone in another role that is a 24/7 role, in the fact that they respond, our rabies person who said it is unlikely after this year that they'll remain in their position. No, we don't have official letters, right? But it's really people giving us the opportunity to make some plans. And our environmental health directors went on vacation just today, and I'm like, oh my, don't let anything happen, because it's 2 weeks without a community health service director, without environmental health director. There's no WIC director. You know, I'm like, there's a lot going on. There's a lot going on. And no immediate relief in hiring.
I spoke, without this additional funding, this probably would have been a non-starter to have that level of position unbudgeted for, just filled. And if there is a concern that, you know, we don't want to grow government, you're starting with the 40 full-time equivalents and you'll,
And with this,
without the nurse, then this is not an, you know, an increase in your full-time equivalents. All of those thinking maybe this would make this more palatable and able to be supported.
So I have an entirely different view on this, as you might expect. You know, since I came on the legislature, I know in 2016, we were so close to having a do not drink order in this county. Talk about being all hands on deck. And when I think about some of the departments, and I know every department has their moments in the sun, so to speak, even though it's not usually a sunny time. Anything that has to do with disaster preparedness. So I think of EMO, I think of the sheriff, I think of you. I think historically, I'm not sure that folks have grouped you in with that, I guess, spotlight. So, you know, I have our own, you know, experience that we went through, but even, you know, the pandemic aside, we had that so close to being a do not drink order. We've had every summer of HABs where not sure how it's going to go and who's going to lead that. It was going to be you. So we've approached crises after crises, and then we went through the pandemic. So to me, this is a no-brainer that you need a deputy. You need somebody who's really can fill when you can't, and give you those other set of arms to put around whatever disaster or whatever's going on. Now, I'm not just speaking though about the disaster. All of the work that the health department does in this community is so far reaching. Early intervention alone is it's huge. It's a huge impact on this community. And although, you know, it's going well and you're finally really staffed there and everything's going well, you know, in 2015, that wasn't the case. So that's taken an enormous amount of effort just for that to get up to snuff. I think folks just don't realize what it's taken for you to sort of get all the different parts of your department, which is tremendous, in order to be functional and really serve the community to the best that we can. So, I mean, I'm fully in favor of this. I'm happy of the grant, but if you didn't have the grant, I think we should find a different way to make this happen. We don't question the fact that EMO is a deputy. We never did. And I think it should be the same for the health department. So I fully support this.
And there are quite a few county departments that have deputy positions. So I agree. Kathleen specifically didn't come tonight with a resolution, you know, oh, here it is, here's my presentation, here's my resolution. I think she really wanted to get real feedback from her own committee, see, you know, if this plan, you know, makes sense and if there would be support here. So, you know, that's basically what you were looking for, just what kind of questions would there be and, you know, what kind of support might there be?
and if there are still questions, you know, I want to be able to have time to talk about them and find some appropriate responses or just the response before whether I get to, you know, bring it forward or not bring it forward.
Right. So would that mean you'll be bringing a resolution at the April meeting?
I would like to.
April HHS.
Thank you so much for this. I just want to say that I know I've been here a year, but I don't feel like it's been enough time to fully grasp everything and understand it all. So I find this to be very helpful. So I very much appreciate this. It gives me a much better understanding of things. So it's great.
Try to pick the highlights.
And I appreciate the quick overview from Aileen's experience, not knowing that in 2015, there was, you know, troubled waters with early intervention, but knowing that statistically for every $1 we spend on early intervention, we save $3 in all kinds of other services throughout one's lifetime. So it's savings that never ends. So the fact that you stabilize that, let's keep it stable, let's surround every program, including early intervention, with everything we need to keep, the financial stuff is important, but also the social, emotional benefits to families and community, to have the access to early intervention from birth on is incredible. I'm glad to hear, and thankful that it's been able to be stabilized in the last 7 or 8 years when it wasn't.
I think it was 2013, I accessed that for my kids here, and having kind of moved from another county. And it was tough. Lori Fisher was our case manager, and it was tough. It was just really hard to maintain case management and related services. I was one of those parents who was calling the health department all the time to say, what is going on? And why are we having these new people coming in? And to have somebody new coming in is a disaster for a family. So to stabilize that program alone as part of the many facets of the health department, I understand what that means to our community. I understand what that means to families. And then results, as we know, when they get to school. So
Yes, there are results. I mean, in my family alone, in my extended family, there was a young child born with dysplasia, would have impacted her walking and her, some physical ability for the rest of her life. And it was amazing to me that this public health nurse and case manager came in working with an infant, and my family member, the child's mother and father, and she's now a kindergartner and she's running like the rest of them. There's no more intervention needed. Without that, this would be a child who wouldn't be in PE, who wouldn't be walking correctly. So it's happening all over silently without people knowing. And that was a referral that came from the hospital, from the child's day of birth.
And I think sometimes people don't necessarily realize they'll hear early intervention. They might know what early intervention is, but they might not realize that falls through the health departments to perform that. So yeah, and a number of our programs.
Lydia has a question, and Dave.
Thank you. I sit in this chair and hear several department heads having the same challenges you do, right? Similar challenges. And it seems like we're not getting to the solution. I completely understand you need a director. I completely understand bench strength, succession planning, all of these things. Why are we still finding ourselves having these conversations? I think as a county, maybe we can find a solution, especially when we start working the budgeting process again, which is going to be sooner than, September's here tomorrow. Can we put together a plan so that you don't have to be standing here incessantly asking for something that makes sense, right? Where we're all working together for succession planning and organizational perspectives and restructuring. Those things should be talked about all the time. In corporate America, and I know people will sit in this room and say, corporate America is nothing like, government. Or maybe we should learn from corporate America because they're making money. We looked at succession planning every month, where we had leadership sitting in rooms talking about it every quarter. We knew where everybody was, what we needed, future. Sometimes I feel that we're looking at other counties and looking to them for answers, and we're nothing like that. So anything that we can do to help so that you don't have to do this all the time, right? And other departments don't have to do this all the time. So,
Great.
I know that this doesn't speak directly to your immediate concern, but we have to start looking a little more long-term and do some forward thinking than having to kind of put out fires every time they start.
This is a disservice of this county not having a manager or administrator.
And I'm going to argue that.
No, I don't, I'm not suggesting, hiring willy-nilly, but I do know that when I started here, you had somebody in your corner as a department head to do all the strategic long-term thinking, and planning. You just had somebody whose sole purpose was to focus on operations. And we don't have that as a formality right now. And I do
That
think,
solution didn't seem to work then either, if I'm not mistaken.
well, that's, we can disagree on that one. Because I would say the position versus the people is the distinction there. So, but I do know from being the chair for 2 years, the department has, this county need a cheerleader. They need somebody paying attention. They need strategic long-term investment. And we aren't delivering. And that's my personal opinion.
And respectfully, I kind of see that that's our job.
And maybe, maybe I spoke about strategic planning because that's not something you can really do from within. You need someone to help guide you through that process, I think, and the limited experience that I've had. I'd like to see that maybe that's something that can be opened up if we're able to identify an appropriate to help with some of that. Again, kudos to Shireen and Diane and some leadership training that they've offered to department heads. And it's 3 sessions, we've gone to 2. It's some of the best stuff I've
Is that who
gone to.
offered it? HR? And
I'm thinking who coordinated it. I thought at the time, I'm like, I'll go because I should set an example, right? Really get value out of it. I really get value out of it. And some of our up and coming, the people that I anticipate that we had internally to move up in leadership spots are getting a lot of value from it and they've been able to participate. So being able to offer things, it really matters.
Yeah, I think we need to take advantage of this grant right now. We can't wait. Lydia came up with a great idea about planning ahead, but now we have to take advantage of this grant. So between Elaine and you, what do you want to do? Do you want to do a presentation? There's only 7 of us here. 8 of us haven't heard this. Do you want to do that presentation at the full edge meeting? So they all know what's going on? Maybe send this out to them prior to that?
Take your guidance.
I think that's what we should do. They've got to know what's going on.
Right, and
You
have.
can't have a resolution in April and that everybody in the world asking questions that night.
But that's exactly the type of guidance I'm looking for here.
And Elaine just mentioned we could each take it to the caucus, to our caucuses and see too. I did talk yesterday with Kathleen, talked with Hans, Jim Basile. Just saw me meeting with Hans. He's like, what are you doing? And I said, here, the paper.
I mean, it's a great idea to take it to the caucus, but we've got to hear the other side too. I mean, both sides have to hear the other side because we know what's going on here. We know the dynamics, what's going on. We all do. So I really think we all need to sit in one room, whether it be a ledge room or the executive session, whatever it may be, and talk about this and get everybody's opinion out before April.
I'm glad to.
I mean, what is,
Whatever's
it's up to you.
matter.
I'd like to support chairman's, and because talking about it separately behind closed doors, come on. Let's just do it together, talk it out.
What venue do you think at the ledge meeting, Ways and Means?
Let Kathleen do the same presentation she just did here,
We're all here.
and we'll all be here, hopefully.
And you could say that.
I'll just put it on the
requested,
agenda.
You participated in HHS and you asked her to do it,
Absolutely.
to see if there's any questions from the full legislature.
And everybody can ask questions. They got a month to absorb it and think about it and bring a resolution in April.
You suggest I send this
I would.
information out to him?
I would, absolutely.
So I can do that.
And bring some hard copies too in case.
Actually, why don't you do this, Kathleen? Why don't you email me that? I'll email it out and tell everybody that you're going to do the presentation. So it'll all be done at once.
Okay.
All right.
Thanks.
Is that okay with everybody?
March presentation for an April resolution. Okay.
Madam Chair, is that okay with you?
It's fine with me. That's fine.
Everybody? What do you think about that, Rich? Is that all right? All right.
Good plan.
All right.
Okay,
All right.
very good.
Thanks.
Thanks, Kathleen.
Thank you.
Yeah.
Is anything else for meeting tonight? Can I get a motion to adjourn?
Adjourn.
Okay, Mike. All right.
Second.
All right.
Thank you.
everybody.
Thank you.
Joe, you're not